Hi, my name is Namita Issa, and this is my checkoff. I have verbalized 8 pre-procedural steps, and I have assessed vital signs, which are blood pressure, pulse, respirations, pulse ox, temperature, and pain has been assessed. Now I'll be going on to general survey and JOMAX. So upon inspection, my patient is well groomed and well dressed for the weather. His mood and affect is appropriate. His behavior is appropriate. His level of arousal is that he's alert and attentive. Next, we'll go on to JOMAX. So, Mr. Issa, what would you do in a fire?
I'd run.
And what are your plans after you graduate college?
Apply for my master's.
Great, so judgment is intact. Next, we'll go on to orientation. So, Mr. Issa, who is the President of the United States?
Donald Trump.
And where are you right now?
In my house.
What time of day is it?
Morning.
And why are you here?
For a physical examination.
Great, so orientation is intact. Next, we'll check for memory. So, Mr. Issa, I will recite a sentence to you, and I would like you to recite it back to me. All dogs go to heaven.
All dogs go to heaven.
When is your birthday?
March 29, 2001.
And what was the weather like yesterday?
Sunny.
Great, so memory is intact. Next, we'll go on to A, which is attention span. Mr. Issa is attentively listening to me. He is talking appropriately, and he has coherent thought process. Next, we'll go on to cognition. So Mr. Issa is able to follow directions, and he is able to think logically. Next, we'll go on to speech, and his speech is fluent. And Mr. Issa, he's well-nourished, and he has good hygiene. Next, we'll go on to skin. So upon inspection of the skin, there are no lesions, no lacerations, no rashes, and the color of the skin is appropriate for race and ethnicity. Upon palpation of the skin texture is smooth, the skin temperature is warm, the skin is moisturized, there is no edema, and then the turgor is less than 2 seconds. Next, we will be going on to hair. So upon inspection, the hair is evenly distributed. Upon palpation, the hair is lubricated, the hair texture is smooth, and the hair is moderately thick. There are no lesions, no scales, and no vermins. Next, we will go on to the nails. So upon inspection of the nail shape is concave, the nail is translucent, the nail bed is pink, and the nail shape is concave. Upon palpation, we can see that capillary refill is less than 3 seconds, and the nail is moderately thick. There's no splitting and no thinness. So, Mr. Issa, could you please go like this for me? So we can see a diamond, so there is no clubbing and curvature is intact. Next, we will go on to head. So Mr. Issa, upon inspection of his head, it is normocephalic and round, and there seems to be no visible masses or nodules. Upon palpation, there are no visible masses or nodules. The contour is intact and scalp is intact. So Mr. Issa, if you could please raise your eyebrows, if you could frown, if you could smile, and show your teeth. Great. So the facial nerve is intact, so that means that cranial nerve number 7 is intact. So next we're going to go on, first we're going to do the frontal sinus and the maxillary sinus, and those are both non-tender. Next we're going to go on to eyes. So the eyelids, the sockets, and the eyebrows are proportionate and symmetric to the face. Mr. Issa, if you could please pull down your eyelids. And we can see that the conjunctiva is pink and the sclera is white. The lacrimal apparatus is non-tender and non-draining. Now we will check for visual acuity. Mr. Issa, if you could please take off your glasses. And please stare directly at an object. Great. So pupils are equal, round, reactive to light, and accommodate concentrally. The red reflex is intact and centralized. So this means that cranial nerves number 2 is intact. Next, we will check for cardinal gazes. So Mr. Issa, if you could please stare straight, follow my finger, but don't move your head. Great. So there's no nystagmus, so now we know that cranial nerves number 3, 4, and 6 are intact. So next we're going to go on to ears. So upon inspection of the ears are symmetric and proportionate to the face. The auricles are non-tender. For an adult, you want to make sure that you pull the pinna up to see inside, and for a child, you want to pull the pinna down. So inside, you should want to check bilaterally, and inside, the TMs should be intact, pearly gray or white, no excessive cerumen, no erythema. Their bony structure should be intact. The cone of light on the right should be at the 5 o'clock position. The cone of light on the left should be at the 7 o'clock position. Next, we'll perform the whisper test. So, Mr. Issa, could you please cover 1 ear? I'm going to whisper something into this ear, and I'd like you to whisper it back to me, okay? 1, 2, 3.
1, 2, 3.
Great. Now plug this one ear, and I'm going to whisper something here.
A, B, C.
Great. So Mr. Iso's hearing is intact, so that means that cranial nerve number 8 is intact. Next, we'll be going on to nose. So nose, it is proportionate and symmetric to the face. Mr. Iso, if you could please push your head back so I can see inside. So mucous membranes are pink and moist. There's no excessive drainage and there's no erythema. And now we'll be checking for patency. So Mr. Iso, if you could please plug one nostril and tell me what you smell.
Alcohol.
Great. And now if you could plug in the next nostril and tell me what you smell.
Alcohol.
Great. So now we can see that patent is intact, and this means that cranial nerve number 1 is intact. Next, we'll be going on to mouth. So Mr. Iso, if you could please say ah. And stick out your tongue. Great. So we can see that the pharynx, the gingiva, the lips, the mucosa, and the tongue are all pink and moist. The uvula and the tongue were midline. There was a rise and fall of the soft palate, and there's no cyanosis, there's no lacerations or lesions, there's no loose teeth and no caries. And so because there was a rise and fall of the soft palate and the uvula is midline, this means that cranial nerves number 9 and 10 are intact. So Mr. Iso, if you could please stick out your tongue, and then if you could please push it up, push it down, and then side to side. And then you can put your tongue back and please say the words light, tight, dynamite.
Light, tight, dynamite.
Great. So this means that cranial nerve number 12 is intact. So next we're going to go on to throat. So upon inspection, there's no visible masses or nodules. Upon palpation of the throat, the neck is supple. There's no rigidity. There's no crepitus. The trachea is easily displaced, and the thyroid is non-palpable. Next, we'll be doing the lymph nodes. So we're going to start with the pre-auricular, post-auricular, occipital, deep cervical chain posteriorly, submental, submandibular, jugulo-digastric, and this is where we can check for TMJ. So Mr. Iso, if you could please clench your jaw, and then if you can please open and close your mouth. Do it one more time. Great. So now we can see that cranial nerve number 5 is intact. So next we go to superficial cervical chain, deep cervical chain, and then supraclavicular. So all lymph nodes are non-tender. So next we'll be going on to cardiovascular. So Mr. Iso, first the heart. The right side of the heart is anterior and the left side of the heart is posterior. The base of the heart is at the right sternal border, and then the apex is at the 5th intercostal space, mid-clavicular line. The S1 is the sound of the closure of the AV valves, and then the S2 is the sound of the closure of the semilunar valves. So what we want to do is we want to listen. So upon inspection, we can see that there are no masses, there are no nodules, and there is no tenderness. So we want to listen. So in a clinical setting, you would want to make sure that your patient is draped and you would listen underneath the shirt, but for your demonstrations, we're going to have our patient clothed for the entire video. So we're going to start at the right intercostal space on, this is the aortic, and this is where you'll listen to S2. Then we'll go to left side, 2nd intercostal space for pulmonic. Then we're going to go to 3rd intercostal space on the left side, and this is Erb's point. Then we're going to go to 4th intercostal space on the left side, and this is your tricuspid. And then we're going to go to 5th intercostal space on the left side, and this is your mitral. So we can see from listening that there's regular rate and rhythm. So next we're going to go and check for the pulses. So you want to make sure when you check for the pulses, you do this bilaterally. So we're going to do carotid. Then we're going to do brachial. Then we're going to do radial. Then we're going to do femoral. I'm going to show it on myself. It's going to be right here. Then we're going to do popliteal underneath the knee. Then we're going to do dorsalis on top of the foot. And then posttibial medial aspect of the ankle, not lateral. So we can see that the pulses are 2+ and they are present. Next, we're going to do the neurovascular assessment. So for pulses, we already said that they are 2+ and present. For color, we can see that there is no pallor. For pain, patient denies any pain. There's no paresthesia, and there's no paralysis. Next, we're going to go on to respiratory. So on the right side, you're going to see that there are going to be 3 lobes, upper, middle, and lower. And on the left side, there are going to be 2 lobes, superior and inferior, and this is due to the placement of the heart. So upon inspection of my patient, anterior and posteriorly, there are no masses, there are no nodules, and upon palpation, there is no tenderness. We also want to make sure we know that the patient is not in respiratory distress. There is no nasal flaring, no accessory muscle use, no tripod positioning, no intercostal or subcostal retractions. So now we will be listening. So first, what we want to do is we want to make sure that we check that the anterior and the posterior aspects of the chest is 2 times the length of the lateral aspect of the chest, and it is. So now we will be listening, and we would make sure in a clinical setting we would do this after 1 full breath, which is 1 expiration and one inspiration, 1 expiration. So now we'll listen. So patient has no adventitious sounds like wheezes and rhonchi. Now we will listen to the back. So patient has regular rate and rhythm, and there's no adventitious sounds, like there's no wheezes and there is no rhonchi. And now we will check for tactile ephemeris. So Mr. Issa, if you could please stand up for me and facing the window. So after I say 99, I would like you to say 99. So 99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99.
99.
Great, so now tactile ephemeris is equal bilaterally. And next we will check for chest expansion. So Mr. Iso, if you could take 1 breath in and 1 breath out, 1 breath in, 1 breath out. Great, so now you can sit down. So now we can see that the chest expansion is symmetric. So next we are going to go on to abdominal. We want to make sure that the patient in a clinical setting is supine position with his arms laying flat on the bed, not crossed, and his knees slightly bent, and we want to make sure we provide privacy. So upon inspection of my patient's abdomen, we would make sure we would drape the patient so we could see the abdomen. So upon inspection, we can see that the abdomen is soft and flat and symmetric. There's no scars, there's no lesions, there's no venous patterns, there's no striae, there's no hernia, there's no ecchymosis, and there's no peristalsis. Next, we will auscultate. We want to make sure we auscultate first before we percuss or palpate, because we don't want to falsify any active bowel sounds. So we want to make sure, if you could, if you go like that, and then we want to make sure we start in the right lower quadrant, left lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. So there was normal active bowel sounds in all 4 quadrants. Next, what we want to do is we want to percuss. So we want to make sure that we percuss twice in each quadrant. So we want to do the right lower, right upper, left upper, left lower. So we could hear that there was a tympanic sound heard through all 4 quadrants. Next, we want to palpate, and we want to make sure that we do a light palpation first to deep palpation. So the right lower quadrant, we want to make sure that we feel for the cecum and the appendix. The right upper quadrant, we want to make sure we feel for the liver and gallbladder. The left upper quadrant, we want to make sure that we feel for the stomach and spleen. And then the left lower quadrant, we want to feel for the sigmoid and descending colon. And so now all organs are non-palpable. So next we're going to check for costovertebral angle tenderness. So Mr. Yusuf, if you could please stand up and face the window one more time. So we're going to go down where the kidneys are. I'm going to put our hands against it and we're going to tap. And we're going to tap. Did that hurt? So now we know we have negative CVA tenderness. Mr. Yusuf, you can go ahead and sit back down. So now we are going to do the neurological assessment. So we're going to check for sensory nerve function. So Mr. Iso, do you feel tell me if you feel a sharp or dull touch. So what do you feel?
Sharp.
Great. And now what do you feel?
Dull.
Great. Now tell me what you feel.
Black.
And where do you feel it?
Right or left cheek.
Great. So now we can see that sensory nerve function is intact. So next we're going to go on to the motor function. So Mr. Iso, if you could please, we're going to watch your gait. So what I want you to do is I want you to walk 4 steps over there and then 4 steps back, but make sure when you're coming back to do heel to toe. Go ahead. Great. And now we can check for Romber. So if you can just stand here and then close your eyes. I have my 2 hands out. Make sure you don't fall. And he is negative for Romber. There's no swaying. Mr. Iso, you can go ahead and sit back down. Next, we're going to check for grip strength. So Mr. Iso, if you could please squeeze my fingers. And he has good grip strength in his wrist. And Mr. Iso, we're going to do a coordination test. So what I want you to do is I want you to tap your nose and then tap my finger. Okay? So tap your nose, tap my finger, tap your nose, tap my finger, tap your nose, tap my finger, tap your nose, tap my finger. Coordination is intact. So the motor functions are intact. So next we're going to go on to the patellar and plantar reflexes. So first we're going to do the patellar. So relax your knee as much as possible. I'm going to find the bend of the knee. I'm going to do it one more time. I'm going to make sure we do this bilaterally. Great. So now we're going to do the plantar reflex. So you please extend your leg. And then I'm going to check for the reflex. Great. So because Mr. Iso's toes curled in, he has a negative Babinski sign. For a child, we would notice that their toes would flare out, and that is a positive Babinski sign. So the reflexes are intact. So next, we're going to check for musculoskeletal. So Mr. Iso, if you could please stand up for me. So we can see upon inspection of Mr. Iso that his joints, his muscles, and his extremity length are all proportionate and symmetric to his body. We can also see that his posture is erect, and now we'll be checking for scoliosis. So Mr. Iso, I'm going to have my hand on your back, and if you could please bend forward slowly. Great. And now please come back. So we can see that the spine is aligned, and we also saw that gait was normal, steady, and rhythmic when we did the motor function test. So now we're going to do the check the range of motion for all of his joints. So Mr. Iso, if you could please scoot back just a little bit. There we go. So if you could please flex your head, extend, and circumduct. Don't let me push. Don't let me push. So good strength in head and good range of motion in his head. So next we're going to do shoulders. So if you could please elevate. Don't let me push down. And then depress. Don't let me push up. So we can see that the cranial nerve number 11 is intact. So next we're going to do your wrist. So please flex and extend and then circumduct. So we have good range of motion in wrist, and we already checked for grip strength, which was good strength. So next we're going to do arms. So please abduct. Don't let me push down. Don't let me push up. And then adduct and then circumduct. Great. So good strength in his arms and good strength and good range of motion. We want to make sure whatever we're doing for the range of motion, we would do it bilaterally. So next we're going to do your hips. So Mr. Iso, you can feel free to hold on to here, but you're going to abduct. Don't let me push down. Don't let me push up. And then adduct and then circumduct. Good. So we have good strength in his legs or in his hip, and there is normal range of motion. So next we're going to go on to feet. So Mr. Iso, you can go ahead and sit back down. So what I want you to do is I want you to flex and extend. Don't let me push down, and then don't let me push up. And then I want you to circumduct. Great. Now we're going to do your ankle. So what I want you to do, you can put your foot down. So what I want you to do is I want you to dorsiflex. Don't let me push down. And then plantar flex. Don't let me push up. And then circumduct. Great. So he has good range of motion and good strength in all of his joints. We can also see once I palpated all of the joints that there was no unusual fluid movement, there was no crepitus, no rigidity, and no nodules. We can see that capillary refill is less than 3 seconds. There's no edema anywhere, and temperature is warm all over. So now I will verbalize my post-procedural steps, and that is the end of my physical health assessment. Thank you. For my self-reflection, I know that I missed the percussion on the respiratory assessment and the facial tics when I did the face, but I know because I missed these will always stay with me forever now. Thank you.